I'm Viv, and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. And tonight I'm very proud and privileged to be able to speak to two aesthetics specialists from the Netherlands, and hopefully they won't be too long in joining me. So I've got Tom van Eijk, who's a world-class specialist in injectables, and also Dr. Leonie Schelke, who specialises in ultrasound. So she deals with aesthetic issues and the use of ultrasound in assessment, diagnosis and treatment of aesthetic problems. They'll hopefully be not too long, so I'll see where they are. Won't be a second. I'll just try and send them an invite. Shouldn't be too long. There you go. Sent them both an invite. They shouldn't be too long at all. So I thought we'd talk about the different types of work that they both do and what they've done in the past, what they're going to be doing in the future. And they're both based in the Netherlands, so it was interesting to be able to speak to both of them at the same time. I've spoken to Tom previously, and that was before Christmas, and it was concerning his work over the last few years, research work that he's done in the past. And it was by accident that I found out that he knew Leonie Schelke as well. So I thought it'd be interesting to find out a bit about both of them. And hi Tom, I've sent you an invite, so hopefully you'll be able to join me without too much problem. There we go. Let's just accept you. Be too long. So yeah, Tom, I spoke to Tom before Christmas. We had a good chat. I think he had COVID at the time, so he should be in a second. Can you hear me, Tom? The blank screen there. I don't know if you can hear Tom. Can you hear me at all? Let's have a look. Just send another invite to both of you. There we go.
Yo.
Ah, hello, you're both together. You shocked me there.
Yeah.
I'm taking up the whole screen.
Oh, I'm not going to judge the two of you. You both look good, so whichever one wants to take the screen up most is fine with me. Nice to see you both. Anyway, you're very close together, aren't you? You could be much closer if you tried. But yeah, it was really interesting to be able to speak to you both over the last few days. We had a bit of a laugh because of mine and Tom's work without using ultrasound. So we'll stay away from that for now, anyway. But
No, we don't.
If you want to ask us questions, Leonie, you're more than welcome, but I don't know if I'll be able to answer many of them, so it's totally up to you. But yeah, thanks for joining me. As I was mentioning, I spoke to Tom before Christmas, and I think you'd had COVID towards the end of last year, Tom, and you were recovering. I think in about November, December time, you were recovering from COVID, weren't you?
Yes, well, it's such a popular disease. I needed to be part of it.
Well, you're a pioneer in things like that, so I think it's quite. It suits you well. It suits you well. So thanks for joining me. I thought I'd have a good chat with both of you about the work that you do, about the types of services that you provide, the research, the training aspects of your work, and also what you're looking forward to in the future, both of you. So I don't know if most people realise, but both of you are based in Amsterdam, and you're both next to each other right now, which I was quite surprised by. And you also know each other prior to working in aesthetics, or perhaps from the start of aesthetics. So I'll go into that with you as we go along anyway. So I've got a few questions. I'll start off with your background. I'll run through this a bit like a story, so I'll start from the beginning and I'll progress from there. So, how would you describe the types of work that you both do, Tom and Leonie?
You go first.
You seem shocked. You seem shocked, like you don't know what to say about your own work. Like, if say somebody was watching, somebody's watching now, and they don't realise that you're both aesthetic specialists, how would you describe to them the sorts of work that you do, the different areas of work that you do?
Well, Leonie is the one that taught me how to inject.
Right.
Oh, very long time ago.
Was it?
It was 18 years ago when she was 12.
Yes. Yes.
I can believe him, Leonie. I can actually believe him when he says that.
Yes, I was 12.
You were 12, right?
No, so I think I was doing this work a couple of years before you, right?
Yeah, you were doing it a couple of years before me. I was an assistant doctor doing plastic surgery.
Yes.
And actually, the clinic you worked for wanted me to be one of their doctors. And
until we really got to know him.
Right.
Yeah.
Was that when in some far away city?
Yeah, I forgot
village.
that completely. Yeah.
Yeah. Well, there was like. You had a side clinic.
Yeah, we had a side clinic.
You didn't care about that, so you put you there.
Thought, let's put Tom over there.
Yeah.
But actually, I thought in the beginning there was no education, right? We're talking about more than 20 years ago.
Mm.
I didn't even know when
8 years, 2004, 3.
Seriously, when I started doing injections, this sounds silly, but I didn't even realize there was anatomy.
Really?
I mean, I never realized all the things that we know now.
Yeah.
So we did this whole basic thing. There was no hyaluronic acid yet. Yeah. I remember Hylaform came in as one of the first HA fillers.
Right.
And we were just doing something. There was no educational platform. Nobody could teach you what to do. And then I don't know even how. I think you met my colleague first, right, Leo?
Yes.
Yes. So I just thought I showed him what I was doing all day. Yeah.
So you're really Tom's first teacher in reality.
In reality.
Absolutely.
Right.
Yes.
Okay.
This is the source.
But I don't think it was very impressive. I do think that he was enthusiastic enough. I think so. You were enthusiastic enough because he kept doing it.
Yep.
Yeah.
And but he went, of course, his own way. That's who Tom is.
Yeah.
And I remember that we spoke on regular basis, and then I met you at the street. Remember?
Yeah.
Yeah. At the corner of the street.
We met in front of the clinic.
Yeah.
And I remember the conversation because I was sitting on my bike and
I was standing next to my bike. Yeah, we all have bikes.
Yeah. So we had this conversation outside, and I kind of described the new way I try to get rid of a marionette fold, and then she said, "Well, Tom, that's a new technique you found there." And that was the moment I realized, maybe I should present it.
Yes, exactly.
Amazing.
Yes.
And now I owe her 50% of what
Has he paid you anything yet, Leonie?
No.
Nothing.
Typical male.
I'm not saying anything. I'm completely neutral in this conversation, so I'll try and stay neutral anyway. So you both become friends, you both become colleagues, and what do you both enjoy about your work? You both do a wide range of aesthetic work in the Netherlands. You both are really famous. Well, Tom, I think probably become famous over the previous number of years, I think, because of you, because of your help with it more than anything. And you and you've got your own professional skills in ultrasound, which is what I really wanted to speak to you about. But in all the work that you do, the training, the treating of patients, the research, all of the wide range of work that you do in aesthetics, what do you really enjoy about your work? What really drives you to do your work every day?
Yeah.
I have no idea. Honestly, I started off in, I don't know, in tropical disease management. Is that something that you still have? So I used to work in Africa, in South Africa, and I like that because I like traveling.
Yeah.
And then I came back and I wanted to do dermatology because of all the Burkitt lymphomas that I saw in Africa. And I did research for hair transplantation, and then I got into this hair transplantation and in this area. And actually, I felt guilty a lot of years because I was supposed to do, you know, very important
ethical
human
stuff.
Yes, exactly. And I just like this work so much. So I like the people, I like what we're trying to do, I like the fact that people like to have a healthy, fresh look. But honestly, I just like my work.
Yeah.
It's simple. I just were talking to another colleague because I think most Dutch colleagues we have a lot of with Fred-Jan.
Mm-hmm.
Yeah, and he said we have a very clear, defined thing that we do. It's a little bit handy. You use your hands, you use your conversation. It's it's not a long project. It's a long base that you have with people. You know each other for a long time. I know some people already for 20 years.
Yeah.
And it's skills. I just like my work. But really, if you ask me why, I wouldn't know. He knows.
Do you actually treat each other? Do you treat Tom? Does Tom treat you in any way aesthetically, Leonie?
No.
We don't trust each other.
No.
Fair enough. You do work around the Netherlands. I think you're both based in Amsterdam, but do you also work in Rotterdam, Leonie? Do you go to Rotterdam as well?
So I just told you that when I started working, there was no hyaluronic acid filler yet.
Yeah.
But we had permanent fillers. We had all kinds of fillers you don't want to talk about anymore. And you also had polyacrylamide, permanent hydrogel. Yeah. And I actually taught Tom how to use it.
Right. Okay.
Yes. I'm so sorry.
Well, it did a good job.
Yeah. So we did see complications after years because it turned out that the water-based permanent hydrophilic filler dihydrates over time. We did a lot of research and we did follow up on histology, and it dihydrates, and by that it degenerates and it becomes a different kind of molecule and you get inflammatory responses. Yeah. So I treated those patients and I was looking at them and I thought, gee, what are we going to do now? So I went to my former head of department, dermatology in Rotterdam, and I said, I don't know what to do with these people. It's private. We're in a private clinic. I don't want to have them paid. So we have in the Netherlands, all complications are reimbursed. Yeah. So I start this polyclinic and I was there once every 6 weeks to see those patients and to see if I could do something for them. And now, 10 years, 12 years later, we have 6 colleagues, 2.5 days of polyclinic, 3 months waiting list.
Wow.
So, yeah, I've run into a colleague and he said, listen, or you Dutch physicians are lousy injectors, or we in France don't know where our complications are. Yeah.
You do great work because compared to other countries around the world, at least you have the ability for patients to be transferred to you. You can take care of them because of your knowledge and your skill in the Netherlands. And I think because of that, a lot of practitioners around the world are now finding your ability to work with ultrasound quite amazing. I think it's going to grow. You've been doing work with ultrasound for several years now, I think. And And other practitioners are only just finding out about the benefits of using ultrasound in their own practice. So I think that's, for you to also know Tom is quite amazing that you've both been able to progress and speak to each other about your individual work. How does Tom get on with colleagues around the Netherlands or around the places he works? How do you do, Tom, in terms of speaking to other practitioners?
No, there are very few I talk to.
No. I'm writing the whole time. That's what happens. And then, yeah.
How many times have you been here? This is my clinic.
First time.
First time.
Is it?
Yes. I met him on the street.
Yeah.
We live in the same neighborhood, so when he's buying French fries, yeah, I bump into him.
I'm going to ask you a question later on about the food in Amsterdam.
Yes.
So I'll ask you this question later on. But do you have any funny stories about your work? Anything that you can remember recently or in the past, either together or separately? Any funny stories that you'd like to tell?
A lot of funny stories, but I cannot tell. No, that would be
any that are okay any that are partially okay to tell. Anything that you think might be funny. I can stop you if it goes too far.
Well, those are the small things. Like, for instance, I had a famous woman in my chair, and the week after, I had the woman that was the actress that played her in that same chair.
Okay.
And it's something you cannot tell anyone. But it's my assistant and I were just looking at this is so weird. If they knew from each other,
yeah,
they would be in a position. That's so weird. Yeah, stuff like that. But you cannot. Of course, you're everybody's secret.
Yeah.
And,
that's changing a little bit, I think.
It's changing.
It's changing. Yeah, when we started doing this, it was definitely a secret, but people were ashamed. I think in the Netherlands, we're a little bit behind a lot of other countries.
Yeah.
But now, I think the 30, 40 years old, it's just they share knowledge. Who's your hairdresser? Who does your Botox? Where your shoes from? So I don't think it's that special anymore.
I met a girl yesterday that with a guy she hooked up with. And we talked about my business and about Botox, and she said, "Oh, I don't have anything." Then the guy turned away to get a beer, and said, "Could you fry?" And she could. And she said, "Well, I have for my migraine."
Yeah.
Okay, that's fine.
Yeah. But even that is changing, because now I get the husbands from the woman I treat, or vice versa.
Yeah.
And I don't know if you have that, but I think that we also have much more younger male coming in compared to years ago. So years ago we had like males in their 40s, and now we have males mid-20 and 20. So no, I don't think, but I think that in the Netherlands we were very conservative in the beginning.
Yeah.
And I remember that you had these museum nights long time ago. I was invited to tell something about my work, and they were throwing tomatoes at me.
Oh, really?
The museum night? Yes, they were, because it was really embarrassing.
I don't think anyone's going to do that these days, Leonie. I don't think you'll have that problem now.
Wow.
Oh, really? Yeah. They did, because people were so,
Tom was telling me that one of his hobbies is sculpting, and his logo for his clinic is a sculpture that he created himself, I think. Do you have any hobbies like that? Any artistic hobbies or anything that you enjoy doing yourself, Leonie?
No. When I was a child, I used to draw a lot, but now I have a dog, and all my friends actually have dogs, so we walk. Especially during Corona. So we walk, we have dogs, and so life is a little bit more boring than it was a couple of years ago, I think. And actually I work, honestly.
Yeah.
I work.
That's no problem. I think everyone can realise just how busy you both are, I think, every day anyway. So I'll get on to the treatments and the services you provide and about the different types of work that you both do. Do you have a favourite treatment or service that you both provide, either to patients or to practitioners, you know, in training? What would you say is a favourite aspect of both of your work?
I like to go with my ultrasound to places where you normally don't go because they're too dangerous. So if you look at the deep fat compartments, they shrink.
Yeah.
And because of that, all your lip elevators will go down. And if you inject more or less there, where you have a lot of arteries and veins and vessels, so we don't go there. But if you can I pinch you? Yeah, sure. So if you inject here at the mid face, you elevate all these areas and you get a good treatment of your V deformity, and it stays stable because we just had an article published with Sebastian Cotofana about the movement. So it stays stable. It doesn't go anywhere. It's still in the same position if you follow up with ultrasound after 18 months. And it doesn't move, so you keep your natural shape. So I like to go there where you normally wouldn't go. And that is treat the medial fat compartment, the lateral side, the soup. So that's my special treatment, I think.
I was actually reading your paper that you wrote, that you mentioned in your Instagram, about the deep fat compartments and the superficial fat compartments. The effect of that, the research you did using ultrasound, and the effect of that on injecting dermal filler at a certain depth in the midface. I think I was having a good read of that, so thanks for mentioning that. I think people, if anyone hasn't read it, have a good read of Leonie's paper looking at deep and superficial fat compartments and injecting.
My last post was about that.
I think I saw some information about you posting to do with that research paper that you wrote with your other collaborators, so thanks for that. And Tom, you do a whole range of different treatments and training. What would you say is a favourite part of your work, either for patients or for practitioners? Do you prefer training, or do you prefer the treatment aspects of treating patients? What would you say about that?
Well, one doesn't exist without the other. I mean, you need to be with your patients in order to know what you're talking about during those sessions. And doing a workshop, doing a masterclass can be really spectacular, because you change the way people inject in just one day. And that's amazing to be a part of that, to see the transformation of an injector. And the surprise, you teach them a little trick. And then they say, oh, but I don't find the wrinkle anymore, it seems to be gone. That's why you're here, right? And that's, I mean, I'm having fun with those people, and I think they have a good time, and they get a lot of, they get a new tool, so they get a lot out of it. Having a happy 7 or 10 people at the end of the day is quite amazing.
And it's something that you can learn in a day, right? That's the nice thing about so start using ultrasound is more of a benefit, of more of experience, more of a steep learning curve. So I think that what you teach them is something that you can do in one day.
You can make the switch, and of course some people come for a second day, but they get exactly the same story, but it works through in your mind, and of course you can switch to higher levels and more difficult areas and stuff like that. So some people come twice, but the course is the same, the logic is the same, and the switch is doable to do in one day.
I was due to come to see you last summer. I was due to come for training with you. You did a masterclass with Tom. Unfortunately, COVID stopped me and a number of other practitioners from the UK coming over to see Tom last year. So I'll ask you some more questions about training and perhaps the two of you working together to provide training. That was something I'll ask you about in a bit. But do you speak to each other about maybe individual patient complications? Do you ever contact each other, or is there ever a need for doing that?
We never have any complication, do we? No, we never had any complication in our whole life, so we don't talk about it.
I'll believe you. I believe you. Don't worry. Nobody. Other people might think differently, but I believe you completely. When I spoke to Tom a few months ago, I messaged him on Instagram and I asked him about you, Leonie, because I'd come across your name earlier in the year because of Gillian at CMAC, based in the UK. And she mentioned about her interest in ultrasound and complications assessment and treatment. And your name came up multiple times. And I thought, Gillian told me that you're based in the Netherlands. So I spoke to Tom, I sent Tom a message and I asked him, do you know this Leonie? And she's based in Amsterdam. And he didn't reply for a day. And a day later, he sent me a message and he sent me a picture of you using an ultrasound scanner on his face in Amsterdam. So I was quite shocked. And he said it's a small world. I know, Leon, we've spoken to each other for a long time. And I think you were carrying out some work on his forehead, or you were assessing his face.
Yeah. He has this Julia Robert thing.
Right. Yeah.
Yes, on his forehead. And we were admiring. He's one of the biggest veins, actually, I've ever seen. No, it's an artery. No, that's
I am vain.
He's vain.
I'm vain.
But you can see these big dilated veins on somebody's head.
Yeah.
But in his case, it's an artery. We have proof of it. Yeah, it is.
I think you mentioned something in the post, Tom, when you had Leonie scan you. You mentioned somebody else's name. Was that because somebody else was involved in an injury or something happened years ago? When you mentioned, when you have a certain line appear on your forehead, you know where it's going to be.
Yes, you mentioned somebody who...
Doesn't matter. It doesn't matter.
I remember that.
I just thought it was somebody.
No, the thing is that normally Tom's treatments are very superficial.
Yes, yeah.
I'm a shallow person.
So the treatment you do fits your personality.
Yeah.
But so he doesn't run into a lot of complications. That's the nice thing about if you go to if you do what he's doing. So it's so superficial, and it's actually more, if I think I'm correct, it's more a mechanical way to stop the wrinkle.
Yeah.
Yeah. And so he's very superficial, and there's not much to do and much to see, so superficial. But his artery actually runs very superficial, but you can see it luckily. But if it wasn't that big, in his case, you would hit it actually, because it goes from the subcutaneous layer, but it touches the superficial layer a little bit.
Yeah.
But you were wondering about that it was something else, remember? You were thinking...
The thing was...
Yeah, that's it. Yeah.
If you take your nail, and you can try that yourself, you take your nail and you rub it over your forehead, you feel a dent.
Yeah.
At least I feel a dent.
Yes.
And I wanted to know whether this was in the skull because of that vein,
right,
or in the dermis.
Yeah.
And we found out that the vessel leaves like a cavity in the dermis.
Yeah.
So
really.
if you frown, the skin will fold at the weakest points, and it's the vessel underneath that determines where the weakest point is.
Right. Yeah.
So I wanted to know, is that dermis, or is it actually the skull? But it is dermis. Dermis gives way to the vessel.
Yeah. I use the fern pattern technique myself. I love using the technique on areas, mid-face, lower face, nose to mouth line area. very few problems, a little bit of redness, but no risk of occlusion. As long as you stick superficial, no risk of occlusion. And you do a lot of work around the forehead using your fern pattern technique, Tom. I think, were you training individuals yesterday in Amsterdam? Were you doing training, carrying out work on the forehead? There was a few Instagram stories I think you posted showing the fact that this isn't a no-go zone for your technique, whereas with normal dermal filler it would be.
Yeah. So I wanted to be a little bit controversial by saying it's a no-go zone.
Yeah. Amazing. There was one question I had, Leonie, from Gillian, actually, Gillian Azima. She was asking about use of ultrasound to detect intra-arterial filler. So suppose somebody had an occlusion, a vascular occlusion with dermal filler, and it was high hyaluronic acid based or reversible. Does hyaluronidase, the enzyme that dissolves hyaluronic acid, can it penetrate through the arterial wall? So it's not needed to be injected directly into the artery. She was wondering about the use of ultrasound to detect movement of hyaluronidase through the arterial wall to actually dissolve filler. Is it possible to do that? Does it make a big difference injecting outside of the artery compared to inside an artery where an occlusion might be? Is there a big difference?
To be honest, I think that, I don't want to be rude, but I think that in our area of medicine, we do not have a lot of evidence about what all we do.
Yeah.
And so there are some papers saying A, there's some papers saying B. So there are some papers that said that hyaluronidase could penetrate the vessel wall. Yeah. And then it turned out that those were cadaver vessels and they are more, well, you know the story, more permeable. Yeah. So we still don't know. Yeah. And we see 2 to 4 vascular occlusions every month. We did now more than 90 ultrasound guided. We know that it works, and we still don't know what we're doing. So you do see, people don't want to have a biopsy. They have occlusion. They don't want to do a biopsy. They want to get rid of their occlusion. Wow. So we do see where the problem is. We do see where the vascular course is abnormal. Yeah. We also see HA. So we remove the HA. And if people come after 3 days of delayal, then you do see that another area is involved. So we think it's spasm, right? They have this theory of Ian Taylor, and he describes spasm also in flap reconstructions. The spasm is protective for the surrounding tissue. Yeah. So it sacrifices itself, that small surrounding, so it protects the remaining head from toxin or whatever. Yeah. So HA is supposed to cause a spasm. But is it causing a spasm because it's outside the vessel, it's touching the vessel, it's in the vessel? We still don't know. What we do see is after 3 days that you have, it's been traced to another area. Yeah. Yeah. But what I remove, honestly, we still don't know, are we removing HA that looks a bit different because it's in the artery? Yeah. Or do we remove thrombosis somehow? Yeah. If you look into literature, the first spasm was described in the First World War. The bullets going through your legs were causing spasm. Right. And you were losing your leg. Yeah. So if you go through whole medicine, everybody, every medical specialty has problems with spasm. Yeah. You have your bleeding, your cerebral bleeding causing spasm. You have variant angina causing spasm. All microsurgeons have problems. Actually, a large percentage of experts, and there's no solution for spasm. Yeah. However, so if you go to literature, you see that they are trying all kind of medicine, all kind of whatever. Nothing really works. And there are also some publications that describe hyaluronidase to release your spasm. Yeah. Yeah. So the next question is, are we dissolving HA or are we releasing spasm? The cases that we had calcium hydroxyapatite occlusions, there's much more inflammation what you see on the ultrasound. We did experimental STS because we had some very nasty vascular occlusions where the tongue was also involved. But we also used hyaluronidase, and it worked. We had everything cleared out, no any other things left. So we still don't know. We are in an academic hospital. We are lacking time. We're lacking money. So we do research, but it's still consuming time. So I still don't know. Is it thrombolysis that we do? Is it releasing the HA? I have no clue. But it works.
That's fine. No, it's just, I thought I'd ask you just purely because it was a question somebody else had asked about that. So thanks for that. I suppose over time progress will be made. There'll be more research carried out looking at the different aspects of occlusion and problems that can occur during an occlusion. So I suppose over time more and more will be learned about that area of complication. I'll go on to research and training with you both, because you're both involved in lots of training, lots of different research work that you've done in the past. What types of aesthetic training do you now both provide, Tom and Leonie? I've got a good idea, but not everyone who's watching will know exactly what sort of training you both provide. So can you just say what you're currently providing for practitioners?
I provide one training only. That's my masterclass, in which I teach people to do the front pattern technique and the lip tenting technique.
Yeah.
And
I think you were doing the lip tenting technique already before the whole Russian lip and whatever.
the Russian lip was mine.
Oh, it was his. I didn't know that, but he was doing.
No, I brought the lip tenting technique to Russia in 2010,
and then
12.
they start calling it the Russian lips because
Yes.
you were doing it already a long time.
I was doing it. I was that.
You should have called it the Dutch technique, the Dutch lip technique.
Well, that's why I called the Amsterdam block to at least keep it on. And the Russian technique is of course infamous because it's so an exaggerated form of the lip tenting technique.
Yeah.
And it's with, where there's no limits to how much people seem to be injecting for that.
Yeah.
And it's about a dramatic projection you can obtain, but you can do it more subtle. The way I do it. But actually, I brought this to Moscow, St. Petersburg, and Vladivostok, all the way down there, Siberia, wherever.
I think most people don't realize that you actually created that lip tenting technique many years ago, almost, what was it, 2012, 2010, you developed that technique quite some years back?
2005.
Yeah, much earlier.
Right.
Yeah, like the patterns for 2003 or 4.
Yeah.
My first Canadian tour was 2005. Or Sweden. So that's a long time. I mean,
yeah. You were in Manchester just recently, weren't you, Tom? In the UK, you flew over to Manchester, carrying out training in the UK. How was that for you?
Well, because of the COVID regulations, that was pretty weird. The thing is, if you come into the UK and you fly back to the Netherlands, you have to be in quarantine in the Netherlands.
Yeah.
And of course, I don't have time to do that. So the only thing I could do is to stay in the UK for less than 12 hours.
Oh, right.
Then you don't have to do that.
Yeah.
So I flew in, my flight was 10:05 Amsterdam time.
Yeah.
Flew in, got into my Uber, got into the classroom, everybody was sitting in line, plugged my computer, did my talk, skipped lunch, did the papers. Like 4:45, there was my Uber back, and I had the plane back at 5:30.
God, that must have been a hard day for you. That must have been a very hard day.
It was weird, more than hard. And the funny thing is, my Uber driver said, "Oh, you'll be back for tea." And that's actually what it was. I was home for supper, like normal commuter, back and forth to Manchester.
You did well.
Yeah, the thing is, everything. I mean, so many things can go wrong on a day like that. I had 2 plane tickets on the way over, one KLM, one EasyJet, to make sure that if one of the 2 were delayed, I could take the other one.
Oh wow, yeah.
And on one back. So I didn't need the second ticket, but well.
Yeah. You did well. And, so you've been over to Manchester, whilst Leonie's been over to Costa Rica not so long ago. So how was your time there? Because your training, I was looking at your training with Cutaneous in Amsterdam, and you've got a 2-day training face-to-face for practitioners. They can do online training as well, I think. They can look at ultrasound training online, and they can spend their own time doing that. But you were over in Costa Rica with other practitioners, including Lee Walker from the UK. I think he was with you as well. How was that for you? How was the training there over the last few weeks whilst you were there?
It was actually great because we didn't have a lot of training opportunities because of COVID. So I think we stopped doing training for 1.5, almost 2 years. Yeah. Because we have a lot of international people coming in and they don't want to go through the same hassle as Tom has to go through. So we skipped a lot of them. We will have one in October now, fingers crossed.
Yeah.
But no,
when?
Nicola, this October.
When?
I don't know. October. It's on the website.
It's on your website somewhere. Yeah. It's on your website. But you must have enjoyed the other practitioners, the other speakers you were working with.
Yeah, it wasn't a normal course. This was really everything. This was Nicola Lowry, and she organized the whole thing, and she did a great job. Yes, she really did. So she invited me, Lee Walker, Sebastian Cotovano was there, virtual, and Stella. And I do some trainings with Stella virtual in Seattle, but I will go to November 17 and 18 to do another course. And, but she had it well organized. It was very nice to have all these other colleagues who were doing trainings as well. And the physicians attending were very enthusiastic. They were very knowledgeable. They knew their anatomy. They were very keen to learn ultrasound.
Yeah.
And so I think we had a great time. Yeah. So we gave 2 courses over there.
Yeah. Do you have any plans perhaps together to work together for training provision, maybe in Amsterdam or abroad? Well, I think it's a great idea. You've got Leonie specialising in ultrasound. You've got Tom specialising in dermal fillers.
No, we could. But the thing is, he is actually a little bit beyond the scope of ultrasound.
Beyond the scope?
Yeah. Well, no, you could see the dynamics actually.
Well,
that
the thing is,
nice. Yes, that would be nice.
Yeah.
I actually organized yesterday's workshop to align your workshop that you canceled.
Yes.
Because
true.
That's why I want to know when in October you're going to have your workshop. Because if people fly in,
yes,
and most people do, it would be great for them to be able to do both workshops. We don't have to work together as in just make sure that people have the ability to do both. Once they're in Amsterdam.
Yeah, people do ask that actually. But no, it would be nice to see if you normally frown or you normally move your wrinkle and you treat it if you have less movement over time. That would be nice. But actually, to see Tom's work, we work with a 2022 megahertz probe preferable, because what we do, the normal treatments, you like to see the bone. You want to see the periosity, you want to see the whole surface from skin to bone. So you don't want to have too much high frequency. And for what Tom is doing, you actually want to have a 30, 32, or even 70 probe frequency, because he is so superficial.
And we did try it at the course. I did the course, obviously. And we did try the probe on my face.
You are able to see it, yes.
You are able to see the hyaluronic acid,
yes.
which is in my dermis.
Yes.
Because of all the ferning.
Yeah.
And that was great to see that it's actually there where I hoped it would be.
And he injected in the right plane. One of the things that I learned from, what I learned from ultrasound is that some of my treatments were perfect and some of my treatments I would rather not have another look at again. Because you are not always in the plane that you think you are. So superficial, so he's always in a good layer. And looking at his skin, so we had a good look at his hyaluronic acid filled dermis, but it's really there, so it's really in the right layer.
Mm-hmm.
Yeah. Amazing. I'll go on.
For ultrasound training, right? It's Cutaneous.org.
Yes, and the next course in October is 8 and 9.
Wow.
October. 8 and 9 October.
Okay, I'll take 10.
Yes.
That's a Sunday, right? 10.
Yes, it's a Sunday.
Yeah.
So
I think a lot of practitioners will be interested in perhaps coming over to Amsterdam and looking at both of your training and look at how they could integrate ultrasound with using like the burn pattern technique, looking at how treatment can be tailored to individual patients and using ultrasound to minimize risk whilst they do that work. I just think it might be something you could think about perhaps together.
Yes, I think that people think about using ultrasound mainly for vascular occlusions.
Yeah.
It works great. You see what's happening, you can dissolve it very precisely, and you see that your flow is restored, so that leaves you and the patient with a very good night's sleep. But you also have a lot of complications we're not aware of. You have like late onset nodules, all kinds of nodules. And I think 9 out of 10, they're there because it was not injected in the right plane.
Yeah.
And that's what we learn from ultrasound, I think.
It's good. No, it's good. What about over the next year or so? What would you both be looking forward to? Do you have any plans for what you want to do over the next 12 months or so?
Well, I have heaps and heaps of workshops that are getting postponed and postponed.
Right. Yeah.
The same.
Yeah. It's dreadful. We're looking at. I mean, I need to be in Dallas September 9th for Aesthetic Next, and like if you look at this situation now, the US is closed and nobody knows when it will open. And I have the rest of September filled with workshops in the US and October in Miami, and it's a dreadful situation that the rules take over reality at this point. I'm double vaccinated, and it's more dangerous for me to sit next to her than to fly to Dallas, right? And we doctors realize that, but politicians don't.
I think you'll be both okay.
Sorry?
I think you'll both be okay for the time being. I think you'll both be all right.
Oh, yeah, I think so. Achoo. No.
But no, it's difficult. I think it's been a difficult 18 months with what's been going on. So I suppose it'll just probably be a case of moving training sessions abroad. The organisers would probably end up having to move quite a lot of things over the next 6 months. In terms of your own knowledge and experience of working in aesthetics with both of you, what advice would you give to practitioners in terms of education, training, their own practice, generally about life in general? What would you say to practitioners who are watching and they've been doing aesthetics maybe some number of years and they've followed yourselves, in the work that you do? What advice would you give them based on your own experience?
Don't trust anyone.
Oh, wow. Now you should ask him, can you explain that a little bit better?
You can have fun.
You wouldn't say that, would you, Leonie? That wouldn't be what you would. What advice would you give?
Oh, it probably says something about yourself when you give advice. No, really, life is short.
Yeah.
Yeah. So, and don't try to be happy all the time. Seriously, I have all these. Okay, my son is 17 and he's struggling with life. You have all these young people, and I don't know how it is in your country, but in the Netherlands, young people have to be happy. Do you know how difficult it is to be happy?
Yeah.
It's impossible. So no, you are sometimes happy, right? But so if you like your job, I think the most lucky you can get in life is if you like your job.
Yeah. Yeah.
I'm a very lucky person. And then secondly, I'm satisfied with what I'm doing, and every now and then I'm happy. But life is very, 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 very short. So if you're then not able to trust somebody, then it's short. No, seriously.
The thing is, there are so many gurus in this business.
Yeah.
And they all say something different, right?
Yeah.
So the thing is, I think you need to be honest with what you do and what you see, and be your own judge whether what you're doing is beautiful and good.
Yeah.
And life is short.
And life is short.
Yeah. No.
So be your worst critic. I mean, and it doesn't stop when your patients are happy.
Ah, okay. Now I get your point.
That's fine.
Yeah. Okay.
But I think you should be more critical than that. And
okay. What I also like to say, you're as good as your last treatment.
Yeah. 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 No, good advice. I think there's a lot of people wondering, should they always be doing things in a certain way? What should they do? What should they change to? I think as long as you're happy and as long as you enjoy what you do, you don't have to be happy all the time, but as long as you enjoy what you do, I suppose that's a good thing.
Yeah, and keep learning. I think keep learning, especially. I think if I look at the older people in the Netherlands who you still have a lot of fun with to talk with, they're people who get education, who keep their mind busy, who are open for new things.
Yeah.
And I think that Tom and me, actually, we're doing this work for a long time. We were one of the first doing this in the Netherlands. So it's very easy to get in your comfort zone.
Yeah, yeah.
And keep doing what you keep doing the whole time. Actually, the courses that we develop, we have an educational developer from the Erasmus University, and she is specialized in how to get those old physicians do something new.
Right.
Because they don't want
old dog, new tricks. Teaching an old dog new tricks.
Exactly. So if you look at young physicians, they are insecure. Everything they do is new. So they learn something new very easily. And maybe it's the same for you, but you're so busy, you're so used to what you do, then you have to do something new. So that's, you should get yourself to that point and keep learning. Yeah.
Thank you. Thanks very much for that. I think it's been great talking to you. I can't believe it's been almost it's been over 50 minutes. I've been chatting away with both of you. I've got a few questions just for a bit of fun. Tom's gone through this with me previously last December, and all these questions are, Leonie, these are just short questions. All I need is a yes/no answer from you, if you can. Or would you rather do one thing or the other? So it's just one or the other, yes or no. Simple questions. It's really just to make you think and just to get the best answer from you quickly. So is that okay for both of you?
Yes.
Okay. First question. Both of you, would you sing karaoke together?
Yes.
Yes.
I won't ask you to sing now. I'll save that for another time. Okay, that's fair enough. Tom, would you rather live in the Netherlands or Ibiza?
Oh, Netherlands.
Netherlands. How was your holiday in Ibiza?
Oh, amazing. I love Ibiza, and it's my favorite backyard. And it's a wonderful place to be and to relax and to eat and to have fun and to enjoy the weather.
That was just a yes or no, right?
Yeah, but he can talk a bit more if he wants to. I don't mind. I'm not going to stop him.
You could let me talk.
Yeah, it's nice listening to both of you anyway. I'll go on to the next question. Leonie, would you like to write a book?
No.
No. Is it time consuming, too much time?
If you're writing a book, I do some chapters from books.
Yeah.
And if you're writing chapters, you do that because something is already explained and it's already known. So you summarize the whole thing that you already have done.
Yeah.
So I rather write a new article.
Okay, no problem. Tom, have you ever fainted or have you been unconscious?
Yes.
Yes.
Can you explain when or how that happened?
Oh, can I say something funny?
Yeah.
Whenever I get lidocaine, I get very funny, my tongue is getting numb, I get like funny tingling and other kind of things.
Yeah.
So we have a famous allergologist, somebody who's doing our allergy test. And I was not allergic for lidocaine. And he said, were you ever conscious? Did you ever lost your consciousness? And I said, yes. So I was driving in my car on a mountain road.
Yeah.
And I woke up upside down in the car, hanging with my head down. And I was, I still don't know what happened.
Really?
So I took the window out. I walked home because I was living in France in that time, and that was it. So I still don't know what happened. But he said having those type of traumas makes you have these feelings with lidocaine.
Really?
Really?
Amazing. I certainly didn't know that. I certainly didn't realize that.
Yeah.
And a question for you, Leonie. Do you play a musical instrument?
Do I play?
Do you play musical instrument?
This is a question I don't want to think about. I'm a girl, right? So I wanted to play, how do you call that? The dwarsfluit?
Yeah, the flute.
The flute, that was my dream. But my father loved the clarinet.
Ah, okay.
So what do you think I was playing?
You were playing the clarinet. Yeah. That's terrible.
My dreams were broken, yes.
That's terrible. There's always time to learn, as you said. There's no harm learning in the future.
Exactly.
One more question.
But it was definitely not my love. No.
No problem. It's a shame that. One more question, both of you. In Amsterdam, you've got a chain of fast food locations called Fibo. Is that right, Fibo?
Yeah.
Would you rather eat in McDonald's or Fibo?
Fibo.
McDonald's. Yeah. I mean, so some of the Fibo are alright, like the grill burger is fine.
Yeah.
But the chips are horrendous.
Are they? Right.
They're so bad.
Okay, to be honest, I don't eat French fries from McDonald's. I don't eat them from Fibo. We eat them at the French Fries Fabric. There are #1 French fries in Amsterdam. They're around far away, 5 walk op de Parnassusweg. Remember? The Frietfabriek?
I've never.
Yes, you were. I met you there. Yes.
I lost my consciousness then.
I wouldn't have thought he'd have forgotten about a time when he met you in a particular location.
I wasn't eating French fries, but you were sitting at the booth.
Yeah.
I've got another quick question for you, Leonie. Clarius L20 HD ultrasound scanner or GE Scan Air? Which of the two?
Both.
I didn't think you'd want to answer that straight easily.
Both.
Both scanners?
I have both of them, and I have the Louis-Fi.
Yeah. You enjoy using all of them?
Yes.
Okay, no problem. Tom, quick question. Have you ever been shocked that a colleague managed to graduate university? when you were at university. Did somebody shock you by graduating?
Yeah, we had that.
Yeah.
Yes, we had. Can I answer instead of Tom?
Please.
Yeah.
We had somebody that was so horrible.
Yeah.
So horrible. So I did pediatrics, and he came in, and this was a horrible situation because the child was dying. The family was saying goodbye, and he wanted to do DNA testing. So he went in, had a scissor, and just cut hair and left. So that was the time. And he was so horrible that everybody let him pass, because if he didn't pass, he had to come back. And they wanted him to come back. Yeah. And then it turned out that before this study in medicine, he did a dental study, and they advised him halfway to pick another study where he shouldn't be with any human beings. So he decided to go into medicine. So that was really, and now actually in the Netherlands, you cannot just apply for the study, and not maybe because of him, but you also have to show that you are able to communicate. I think that's something in the last years that we have. Yeah.
Well, you both communicated very well tonight, so I've got to thank you both for that. I can't believe an hour has passed already, so I think we're going to get kicked off Instagram, unfortunately. So I'm going to thank you both for a really enjoyable chat with me for this last hour. And I hope maybe we could do this again at some point, maybe look at other areas of practice, and over time we could see how you both have carried on over this last 12 months. So in future, if you've got time at some point, maybe in the next year, I'd love to speak to both of you again, if that's okay with you.
If you come to the Netherlands and you do our courses together, we have mutual Instagram. Then we are not the two of us, but the three of us.
Yes. I will come to see both of you at some point. Once this coronavirus problem is finished and once traveling is eased, I will make sure I come to visit both of you in Amsterdam. So thank you very much for that. Did you want to say hello to anyone, or did you wanted to say anything to anybody?
Use ultrasound.
Just ultrasound.
Follow me.
Follow him.
No, follow Tom. Follow Leonie. Both fantastic practitioners.
Actually, I really think that we're all lucky to be in this field of medicine, right? Yeah. No, it's really nice to be able to speak to both of you, and it's fantastic that you both managed to join together tonight to be on the live together. So thanks a lot for that. I will catch up with you both at some point soon, and I'll just say thank you very much for joining me, and I'll be able to post this video online. People can watch it in their own time, and I'll put it up as a podcast on Spotify and on a few different podcast channels. So thanks again for all your help tonight in talking to me, and I hope you have a great night, Tom and Leonie.
Thank you so much.
Thank you so much.
Thanks a lot. Bye.